So we'll be discussing about risk factors for breast cancer. Broadly speaking, there are 7 risk factors. First, we'll discuss about age and gender. With increasing age, risk for breast factor increases. And age is the most important risk factor out of all the risk factors. With respect to gender, breast cancer in female is more common than male. The next risk factor is reproductive risk factor. The risk is directly proportional to period of exposure to estrogen. So early menarche, that is less than 12 years of age. Late menopause, more than 50 years of age. Late delayed first childbirth, more than 30 years of age. Nulliparity, all of this increases risk for breast cancer. A full-term pregnancy less than 18 years of age as a protective factor and reduces risk by about 50% in comparison to full-term pregnancy after 30 years of age. Moving on to third risk factor is personal history. So cancer in one breast increases risk of breast cancer on the other breast. History of radiation exposure less than 30 years of age increases risk. Example being Hodgkin's lymphoma. Fourth risk factor is family. Here we must know what is a first degree relative. These include sisters, daughter, mother. All of these three come in the first degree relative. So any history of breast cancer in the first degree relative increases the risk for breast cancer by 2 to 3 times. And this has an autosomal dominant pattern of inheritance. Fifth, being genetic factor. Here there are 2 important genetic factors, BRCA1, BRCA2. These are nothing but tumor suppressor genes. BRCA1 is situated in the long arm of chromosome 17, while BRCA2 over chromosome 13. So mutation in these 2 genes, BRCA1 and BRCA2 genes, predisposes to breast cancer. BRCA1 is responsible for about 40% familial breast cancer, while this is responsible for around 30% familial breast cancer. In BRCA1 mutation, along with the breast cancer, there is risk for ovarian cancer. Even here, there is risk for ovarian cancer, but more with respect to BRCA1. And these breast cancers are known to be triple negative, BRCA1, triple negative, and has a basal type histology. Here, hormone receptors are positive. So triple negative means ER, PR, HER2/neu negative. ER, PR, HER2/neu negative. So hence BRCA1 mutation have a poor prognosis with respect to BRCA2. Both of this, BRCA1 and BRCA2, it is advisable to do MRI screening and must be considered for a prophylactic mastectomy. Moving on, we move to the next risk factor, that is exogenous hormone. Exposure to hormone replacement therapy in post-menopausal state, in post-menopausal phase, or contraceptive measures, contraception in premenopausal both of which increases risk. Other factors include exogenous hormone intake for menstrual irregularities, polycystic ovarian disease for fertility treatment, and hormone insufficiency. In a postmenopausal woman with an intact uterus, a estrogen and a progesterone combination increases risk for breast cancer. Seventh risk factor is histology. So if you consider benign breast disease and their risk for breast cancer, a non-proliferative breast lesion has no risk for breast cancer. A proliferative breast lesion without atypia has some risk factor. Next, a proliferative lesion with atypia, example being atypical ductal hyperplasia or atypical lobular hyperplasia. There is more risk than the proliferation without atypia. Next is atypia with the positive family history, further increases the risk. And lastly, lobular carcinoma in situ, the highest risk for breast cancer. Some of the other risk factors include smoking, alcohol intake, obesity. So we come to the end of the risk factors.